The double whammy, understanding mixed dementia. Dementia is a term that many of us are familiar with. It's a debilitating condition that affects millions of people worldwide. However, there is another type of dementia that is not as well known, and that is mixed dementia. As the name suggests, mixed dementia is a combination of two or more types of dementia, and it is becoming increasingly common. Mixed dementia can be a significant challenge for caregivers and loved ones, as it can be challenging to identify the different types of dementia affecting the individual. In this post, we will explore what mixed dementia is, what causes it, and how it differs from other types of dementia. We will also provide tips on how to manage the condition and enhance the quality of life for those affected. 1. Introduction to dementia. Dementia is a general term that refers to a decline in cognitive function that is severe enough to affect a person's daily life. It is not a specific disease but rather a collection of symptoms that can be caused by a variety of conditions. Alzheimer's disease is the most common cause of dementia, accounting for 60 to 80% of cases. However, there are many other types of dementia, including mixed dementia, which is a combination of two or more types of dementia. Dementia affects millions of people worldwide and is a growing concern as the population ages. The symptoms can include memory loss, difficulty with language and communication, problems with reasoning and judgment, and changes in mood and behavior. These symptoms can be distressing for both the person with dementia and their loved ones, and can have a significant impact on their quality of life. It is important to understand that dementia is a progressive condition, meaning that the symptoms will gradually worsen over time. However, with the right support and care, people with dementia can continue to live fulfilling lives for many years. In this blog post, we will explore the different types of dementia, with a focus on mixed dementia, and provide tips for managing the symptoms and improving quality of life for those affected. 2. What is mixed dementia? Mixed dementia is a medical condition that affects the brain, where two or more types of dementia occur simultaneously. It is a condition that is becoming more common, and it is believed to affect up to 1/3 of individuals diagnosed with dementia. The most common combination of dementia types seen in mixed dementia is Alzheimer's disease and vascular dementia. The symptoms of mixed dementia can vary greatly depending on the combination of types of dementia that the individual has. Symptoms can include memory loss, difficulty with language and communication, changes in personality or behavior, and difficulty with movement or coordination. It is important to note that the symptoms of mixed dementia can be different from those of other types of dementia, so it is important to get an accurate diagnosis from a medical professional. The causes of mixed dementia are not well understood, but it is believed that a combination of genetic and environmental factors may play a role. It is also thought that certain lifestyle factors, such as diet and exercise, may help to reduce the risk of developing mixed dementia. If you or a loved one is experiencing symptoms of dementia, it is important to seek medical advice as soon as possible. A correct diagnosis can help to ensure that appropriate treatment is provided, and can also help to improve the individual's quality of life. 3. How is mixed dementia diagnosed? Diagnosing mixed dementia can be a complex process. Since mixed dementia presents symptoms similar to other types of dementia, the doctor will conduct a thorough medical examination, which includes a physical examination, a review of the patient's medical history, and cognitive and neurological tests. The cognitive test includes assessing memory, language, attention, and problem-solving skills. Neurological tests, on the other hand, may include brain imaging tests such as MRI, CT scans, or PET scans, which help detect any changes or abnormalities in the brain. Blood tests and other diagnostic tests may also be ordered to rule out other conditions that may have similar symptoms to mixed dementia. It is worth noting that diagnosing mixed dementia can be challenging, and in some cases, it may be difficult to determine if the patient has mixed dementia or if they have two separate types of dementia. In such cases, the doctor may need to conduct further testing, or the patient may need to be monitored closely over time to determine the exact form of dementia they have. It's important to remember that early diagnosis is crucial in managing the symptoms and slowing the progression of dementia, and seeking medical attention as soon as possible is essential in getting an accurate diagnosis and developing a treatment plan that works for the patient. 4. What causes mixed dementia? Mixed dementia is a complex disease that has a variety of causes. In most cases, it's caused by a combination of two or more types of dementia, with Alzheimer's disease and vascular dementia being the most common. Alzheimer's disease is a type of dementia that causes memory loss and cognitive decline, while vascular dementia occurs when the blood supply to the brain is interrupted, which can cause problems with thinking, memory, and behavior. Mixed dementia can also be caused by other underlying conditions, such as Lewy body dementia or frontotemporal dementia. These conditions are caused by the accumulation of abnormal proteins in the brain, which can cause damage to brain cells. Age is also a significant risk factor for developing mixed dementia, as the risk of developing dementia increases as a person gets older. Additionally, lifestyle factors such as smoking, poor diet, and lack of exercise can increase the risk of developing mixed dementia. It's important to understand the causes of mixed dementia, as this can help with early diagnosis and treatment. While there is no cure for mixed dementia, early diagnosis can help to slow the progression of symptoms, and there are medications and therapies that can help to manage the symptoms of the disease. 5. The symptoms of mixed dementia. Mixed dementia is a complex medical condition that manifests in a variety of ways, making it difficult to diagnose. The symptoms of mixed dementia are broad and can vary from person to person, but they typically include a combination of cognitive, physical, and behavioral changes. Cognitive symptoms of mixed dementia can include memory loss, confusion, difficulty with problem solving, language problems, and difficulty with reasoning. Physical symptoms can include difficulty with balance and movement, difficulty with daily activities, and changes in appetite and sleep patterns. Behavioral symptoms can include depression, aggression, and social withdrawal. It's important to note that the symptoms of mixed dementia can be similar to those of other forms of dementia, such as Alzheimer's disease or vascular dementia. Therefore, it is essential to work with a medical professional to receive a proper diagnosis and treatment plan. If you or a loved one is experiencing any of these symptoms, it's crucial to seek medical attention right away. Early diagnosis and treatment can help manage the symptoms and improve the quality of life for those living with mixed dementia. 6. Caring for a loved one with mixed dementia. When a loved one is diagnosed with mixed dementia, it can be overwhelming and challenging to know how to provide the best care. Mixed dementia can be a complex and unpredictable condition, with a combination of symptoms from multiple types of dementia, such as Alzheimer's and vascular dementia. It's important to understand that each person's experience with mixed dementia is unique, so there is no one-size-fits-all approach to caregiving. Firstly, it's important to consult with a healthcare professional to create a personalized care plan that takes into consideration the individual's specific needs and limitations. Caregivers should also educate themselves on the different types of dementia, including their symptoms and how they can affect their loved one's behavior and emotions. Secondly, caregivers should prioritize safety. This may include making modifications to the home environment to reduce the risk of falls, ensuring medication is taken on time, and supervising the individual to prevent wandering. Thirdly, caregivers should prioritize communication and connection with their loved one. Individuals with mixed dementia may have difficulty communicating, so it's important to be patient, use nonverbal cues, and listen attentively. Spending quality time together, such as engaging in a favorite activity or reminiscing about happy memories, can also improve mood and overall well-being. Lastly, caregivers should not forget to take care of themselves as well. Caring for a loved one with mixed dementia can be emotionally and physically exhausting, so it's important to make time for self-care, seek support from others, and not be afraid to ask for help when needed. 7. Treatment options for mixed dementia. Treating mixed dementia can be a challenge because it involves addressing two different causes of cognitive decline. However, there are treatment options available that can help slow down the progression of the disease and improve the quality of life for the patient. The treatment plan for mixed dementia typically involves a combination of medications, lifestyle changes, and support from healthcare professionals. Medications can include cholinesterase inhibitors, which are often used to treat Alzheimer's disease, as well as medications to manage other symptoms such as depression or anxiety. It is important to note that medication options and dosages will vary depending on the individual and their specific needs. Lifestyle changes such as regular exercise, a healthy diet, and mental stimulation through activities such as puzzles or social interaction can also be helpful in managing symptoms and slowing the progression of the disease. In addition to medication and lifestyle changes, support from healthcare professionals such as occupational therapists, speech therapists, and social workers can provide valuable assistance in managing the disease and improving the patient's quality of life. It is important for caregivers and family members to work closely with healthcare professionals to create a tailored treatment plan that addresses the unique needs of their loved one with mixed dementia. With the right combination of treatments and support, patients with mixed dementia can continue to live a fulfilling life for as long as possible. 8. Understanding the long-term outlook for mixed dementia. Mixed dementia is a complex condition that affects individuals in different ways, making it difficult to predict the long-term outlook for each person. The progression and severity of the disease depend on several factors, including age, overall health, and the specific combination of underlying causes. In general, the progression of mixed dementia tends to be faster than that of other types of dementia, such as Alzheimer's disease or vascular dementia. This is because mixed dementia affects multiple areas of the brain, leading to a more rapid decline in cognitive function and overall health. Additionally, the outlook for mixed dementia can be influenced by the underlying causes of the condition. For example, if the dementia is caused by Alzheimer's disease and Lewy body dementia, the symptoms may progress more rapidly and be more severe than if the condition were caused by Alzheimer's disease and vascular dementia. Despite the challenges of predicting the long-term outlook for mixed dementia, there are steps that can be taken to manage the condition and improve quality of life. These may include medications to manage symptoms, lifestyle changes such as diet and exercise, and support from caregivers and healthcare professionals. It's important for individuals with mixed dementia and their loved ones to work closely with their healthcare team to develop a personalized treatment plan that addresses their unique needs and goals. 9. How to reduce the risk of developing mixed dementia. Mixed dementia is a complex condition that can be challenging to manage. However, there are steps you can take to reduce the risk of developing this condition. Here are some tips to keep in mind. 1. Stay active. Engage in regular physical activity, such as walking or swimming, to keep your brain and body healthy. 2. Eat a healthy diet. Include plenty of fruits, vegetables, and whole grains in your diet. Limit your intake of processed and high-fat foods. 3. Manage chronic conditions. Work with your healthcare provider to manage chronic conditions such as high blood pressure, diabetes, and high cholesterol. 4. Stay mentally active. Engage in mentally stimulating activities such as puzzles, reading, and learning new skills. 5. Get enough sleep. Aim for 7 to 8 hours of sleep each night to help your brain recharge. 6. Avoid smoking and excessive alcohol consumption. Both smoking and excessive alcohol consumption can increase your risk of developing mixed dementia. By following these tips, you can reduce your risk of developing mixed dementia and other forms of dementia. However, it's important to remember that some risk factors, such as age and genetics, cannot be controlled. If you have concerns about your risk for dementia, talk to your healthcare provider. 10. Conclusion and additional resources. In conclusion, mixed dementia is a complex condition that can be challenging for both patients and caregivers. However, with proper diagnosis and treatment, many people with mixed dementia can manage their symptoms and maintain a good quality of life. If you or a loved one has been diagnosed with mixed dementia, it's important to work closely with a healthcare provider who specializes in dementia care. They can help you develop a personalized treatment plan that addresses your unique needs and challenges. There are also many resources available for people with mixed dementia and their families. The Alzheimer's Association, for example, offers a wealth of information and support services for people with all types of dementia, including mixed dementia. Other resources include online forums and support groups, local caregiver support groups, and respite care services. Remember, you are not alone in this journey. With the right information, resources, and support, you can manage the challenges of mixed dementia and provide the care and compassion your loved one needs. We hope you found our article about mixed dementia informative and helpful. It can be a challenging and confusing condition to understand, but we hope that we have provided some clarity on what it is and how it is diagnosed and treated. We know that dealing with dementia can be tough, but with the right support and care, it is possible to manage the symptoms and maintain a good quality of life. Keep learning, and most importantly, be kind and patient with yourself and your loved ones.